Hello, everyone, and welcome to the Paid Family and Medical Leave 101 webinar. We are so glad to have you all here. I'm Sarah Mann. I'm a senior policy analyst for the Voices for Healthy Kids team, and I am joining you from Boulder, Colorado. To start us off, we've got a few housekeeping items that we can get out of the way. First of all, if you don't mind, please take a moment, if you haven't already, to introduce yourself in the chat box with your name, organization, and location so we can know who we all have with us today. Just so you know, today's call is being recorded, and we will be sharing the recording, slides, and reference tools and resources within a week. So please watch your email inbox for those items. We do ask that you please keep yourself on mute when not speaking to help us ensure good sound quality throughout the webinar. If you need assistance during the call, please message Andrea Guillermo during the chat. She will be happy to help you. We will be having a Q&A session at the end of the call. If you have any questions, you can either enter them directly into the chat or feel free to raise your hand. We will call on you and you can come off mute to ask your questions. At the end of the session, we will be sharing a brief survey and we will ask you all to take 2 minutes to complete it. We really do take your feedback seriously, and it will help us make these types of webinars better in the future. So we appreciate that and thank you in advance for taking the time to do that. Again, if you haven't, take a moment to introduce yourself in the chat box. And I am really excited to introduce today's presenters from A Better Balance, which is a national nonprofit advocacy organization that uses the power of the law to advance justice for workers. We are joined by Feroza Freeland. She joined A Better Balance in 2019 as a policy associate in the Southern office. She is a proud native of Memphis, Tennessee, and is passionate about pursuing more just and equitable public policies in the South. She has worked on a variety of legislative and electoral campaigns across the state of Tennessee and has engaged in organizing and policy advocacy on issues including workers' rights, equity in public education, and healthcare access. We also have Cassandra Gomez. She has been a member of A Better Balance's staff since 2019. She works nationwide at the local, state, and federal levels to advance inclusive paid sick leave, paid family and medical leave, and emergency paid leave measures. She also leads A Better Balance's family recognition work to ensure that workers can take time off of work to care for all of their closest loved ones, regardless of legal or biological relationship. We are so thankful that Feroza and Cassandra are able to join us today, and I'm happy to hand the presentation off to them.
Thank you so much. Thanks everyone for joining us today, and thank you for having us. We are really excited to talk with y'all today about paid family and medical leave. There's a lot of exciting things happening on this issue across the country, and so we are excited to dive in. And just to start off, before we get into it, we did want to share a brief overview about our organization for folks who may not be familiar. A Better Balance is a national legal advocacy organization. Essentially, our mission is to ensure that everyone is able to care for themselves and their loved ones without risking their economic security. So we have offices across the country. I am based in our Southern Regional office in Nashville, Tennessee. We also have offices in New York, where Cassandra is based, as well as Colorado and Washington, D.C. And so part of what we do is that we provide direct legal services. We have a free and confidential legal helpline that takes calls from all across the country, from workers who are really struggling to navigate caregiving needs or personal medical needs in the workplace, who are needing time off or needing accommodations. And you can see that number is at the top of our slides here. We also do a lot of trainings for workers. We have a lot of know your rights information on our website as well. And we also engage in policy advocacy work at the local, state, and federal levels, which is, of course, what we'll be really focused on here today. You can see on this slide several of our different policy priority areas. But of course, today we're going to be doing a deep dive into paid family and medical leave specifically.
Thank you so much, Feroza. As Feroza said, today we're talking about paid family and medical leave. And with that, we thought we would start by defining what that actually means. So when we're talking about paid family and medical leave, we mean leave taken over a period spanning several weeks and can also be used for up to a few months. Generally speaking, paid family and medical leave can be used when a worker has a serious health condition, when they need to bond with a new child, when they're caring for a seriously ill loved one, or if they have certain military family needs in relation to a family member's deployment. So, for example, if a worker needs leave from work to care for their parent who has cancer, or if the worker needs to take time off because they're having a baby or adopting a child, they may be able to take paid leave. And I'll talk a bit more about this later, but paid family and medical leave programs are also social insurance programs where workers and employers make small contributions to one fund, which then goes on to pay benefits to workers while they're on leave. And I also just wanted to take a moment to explain that paid family and medical leave is different than paid sick leave, which can also be called paid sick time or paid sick days. And I just wanted to talk about that a little bit because the two get mixed up sometimes. But paid sick leave, it's for shorter term leaves that can range from a few hours to a few days. And that's meant to give workers time off for things like going to a dentist appointment or to stay home with a sick kid who has a cold. Paid sick leave and paid family and medical leave, are both important protections that workers need in their tool belts, as they both come in handy during really different life moments. But today, our focus again is on the paid family and medical leave end. Oops. All right, so now that we're on the same page about what paid family and medical leave is, we'll talk a bit about why paid family and medical leave is so important. And one of the biggest reasons that access to paid family and medical leave is so critical is that it helps support the health of workers and their families. So the latest data from the Bureau of Labor Statistics shows that many workers in the US don't have access to paid family and medical leave. Only 24% of private sector workers receive paid family leave through their employers, and that number is even lower amongst low-income workers. And about 3 in 5 private sector workers lack access to short-term disability insurance through their employers, which leaves them really vulnerable when they need time off to address their own serious health needs. And this lack of access to paid family and medical leave leads to really devastating consequences where workers need to take time off to care for them, when workers need to take time off to care for themselves and their families. And it just puts them in a situation of having to choose between their health and their financial security. But when workers do have access to paid family and medical leave, they can take the time off they need without having to worry about their job or their paycheck. Paid family and medical leave has also been shown to provide substantial health benefits for workers and their families. A really astounding number is that 1 in 3 US adults under 65 has at least one chronic health condition, and paid medical leave, allows workers to get the treatment they need when they need it. So for example, paid medical leave helps cancer patients and survivors determine their course of treatment, follow through with that treatment, importantly, afford that treatment and manage their side effects. Paid leave is also associated with better physical and mental health for mothers and a reduction in infant and child mortality. Specifically, women who take paid leave after giving birth have a 51% decrease in the odds of being rehospitalized within 21 months of giving birth, as compared to those who took unpaid leave or no paid leave or no leave at all. And in one study, an increase of 10 full-time equivalent weeks of paid leave reduced neonatal and infant mortality rates by 10%, and the mortality rate of children younger than 5 by 9%. Paid family leave also has significant health benefits for both caregivers and care recipients. Research shows that access to paid leave improves caregivers' mental and emotional health, and that care recipients have better health outcomes when they're cared for by a family member.
Thanks, Cassandra. And I'm going to jump in and talk about another key consideration here, which is that paid family and medical leave is also really an issue of gender and racial equity. It's one of many, many tools that we have in terms of policy tools to address some of the gender and racial inequities that we have in our society, and really wanted to kind of connect some of those dots for y'all today. We know that women and people of color tend to have less access to paid leave through their employer than other groups. We also know that the vast majority of families with children across the country are depending on working mothers as the primary or co-breadwinner for the family. And we know that Black women are more likely to be breadwinners for their families and to also be shouldering family caregiving responsibilities as well. So, when those working moms do not have access to the paid time in order to take care of their caregiving responsibilities, it really has harmful impacts on the entire family and their economic security. We also know lack of access to paid leave makes the existing disparities even worse, contributing to the racial wealth gap and the racial and gender wage gap. And so, those are some of the economic factors, but as Cassandra just touched on, there's also a lot of health reasons. Paid family and medical leave can be one tool in our toolbox to address the really shameful racial disparities that we still see across the country in maternal and infant health outcomes. For all the reasons that Cassandra mentioned, it helps support not only physical recovery, but mental health of new parents, and, helps to establish breastfeeding, and just even to make sure that new parents can go to their postpartum doctor appointments, and, also for their children to get their own medical checkups. So there's so many important ways that paid family and medical leave can help reduce racial disparities in health outcomes, particularly. And then the last point here is we will be talking a little bit later in the presentation about paid family leave policies specifically for public sector workers that work for, state and local governments. And that is particularly important because we know that both women and Black workers are disproportionately represented in the public sector workforce. So, it's really important to make sure that those workers have these protections that they need. So these are just sort of a few of the ways that, this policy area ties back into gender and racial equity, but, it's really a key point of all of these discussions. So I will kick it back to Cassandra.
Thanks. And then just one last key piece here that we always lift up as well is that paid family and medical leave is also good for business. In particular, paid family and medical leave has been shown to really help level the playing field for small businesses. So as I explained a little bit earlier, paid family and medical leave programs are structured as social insurance. So that means that workers and employers make small contributions to the program, which helps to make paid family and medical leave affordable for small businesses that might not otherwise be able to afford to offer paid family and medical leave benefits to their employees. Paid family and medical leave can also help businesses recruit and retain workers and can increase profitability and employee productivity. So polling recently has shown that prospective employees are more likely to relocate to states with paid family and medical leave programs. So this is very much top of mind for workers and recruitment for workers. And one study found that businesses in states with paid family and medical leave laws significantly increased firm-wide productivity as compared to similar businesses without paid leave. In another state, an average of 63% improvement in revenue and 54% improvement in profit was found after companies went on to adopt paid leave policies. So paid leave, in addition to being good for workers, being good for family health, being a policy that supports the racial and economic equity that Feroza was addressing, can also help businesses as well. So now that we have some background on why paid family and medical leave is important, I'll spend the next few minutes giving just a super brief overview of the key components that build strong paid family and medical leave programs. So this first point that I'll talk about is which workers are covered by the law or who is included within the scope of the law's protections. So the best practice here is to cover all workers regardless of their employer's size, and including both the public and private sector. Paid family and medical leave programs should also allow self-employed workers, like an independent contractor or a freelancer, to choose to opt into the program. And it's also especially important to ensure that historically underprotected workers, such as domestic workers and seasonal and part-time employees, also have access to the program. Then for covered purposes, best practice here is to allow workers to take leave for at least their own serious health needs, bonding with a new child, whether through birth, adoption, or foster care, caring for a seriously ill loved one, as well as for addressing the impact of military deployment and for certain needs when the worker or their family member is a survivor of sexual or domestic violence, which is also known as safe leave. And then this last one on this slide here is about family definitions. So as far as family definitions go, every paid family and medical leave law specifies the family members for whom workers can take leave to care for when the family member has a serious health condition. And the best practice is to cover all of a worker's closest loved ones, regardless of their legal or biological relationship. And this ensures that all families are honored and protected by the law. And then just a few more points on best practices. For the number of weeks that workers can take leave and receive benefits, best practice is to allow for at least 12 weeks for all covered purposes. And 12 weeks is really a starting place, though. Many paid family and medical leave programs go beyond that and provide more leave. Next is the wage replacement rate, and that's the percentage of their income that workers receive while on leave, which that should be high enough to ensure that all workers can afford to take leave. So in particular, it is best practice to use what's called a progressive or a graduated wage replacement rate, where lower income workers receive a higher percentage of their incomes. And this ensures that everyone can actually afford to take paid family and medical leave. And benefits are also in programs capped, subject to a weekly cap, which should adjust over time and it isn't just like a fixed number. As far as eligibility requirements go, or how covered workers with a need for leave become eligible for paid family and medical leave benefits, the best practice here is to set accessible eligibility standards to ensure that as many workers as possible are eligible for benefits. So for example, there might be like a small earnings requirement for workers to access benefits. And that might sound familiar to folks because it's sort of similar to what you see in unemployment insurance programs. Benefits should also be portable. So that means that workers can keep their benefits as they move from job to job, or they can combine multiple sources of income to be eligible. Portability also means that previously covered workers can access benefits during periods of unemployment. And then lastly, I just want to touch on employment protections. So the best practice is to ensure that all workers have the right to return to work following leave and cannot be punished or fired for taking leave. And these protections can include the right to get your job back following leave, protection against retaliation or interference with leave taking, and the continuation of health insurance coverage during leave, which, as you can imagine, is really important to workers who are taking paid family and medical leave. Okay, so understanding the need and the critical benefits of paid family and medical leave, thus far, 11 states and Washington, D.C. have enacted comprehensive paid family and medical leave laws. You can see the states. They're listed out here on the slide, but they're also, for visual learners like me, in this little map here, the states with the blue have paid family and medical leave laws on the books. And while the details of each program vary, these state paid family and medical leave programs, again, are social insurance programs that are paid for by small contributions from some combination of workers and employers. The exact breakdown varies state by state. And on our website, we have a comparative chart that breaks down all of the specific policy points that I just talked about for each of these programs. And just to look at these a little closer, in Rhode Island, California, New Jersey, New York, DC, Washington State, Massachusetts, and Connecticut, paid family and medical leave programs are already up and running. So covered workers in those states are currently able to apply for and receive paid family and medical leave benefits. And then in Oregon and Colorado, while there are paid family medical leave laws on the books, those programs are not yet paying out benefits to workers. They will begin to pay out benefits in 2023 and 2024, respectively. And then Maryland's and Delaware's programs will both begin to pay benefits to workers in a few years in 2026. There are also many more states that are actively working on campaigns to bring comprehensive paid family and medical leave programs to their states. And we at ABB, we are really happy to support these efforts. And we can definitely talk more to anyone who wants to talk a little bit more about that. But for now, I'm going to go ahead and pass it back to Feroza.
Thanks, Cassandra. So as I mentioned earlier, we also wanted to touch on a lot of exciting progress that has been happening for public sector workers on this issue. And this, we've been seeing this progress, especially more so in purple and red states. I do want to note that the public sector policies are not structured in the same way as the statewide programs that Cassandra was just talking about. These ones are not structured as a social insurance model. Typically, it's just the state government or local government would budget, for the leave within their budget and provide that directly to their employees. But as you can see here, and I do want to note, this is not a comprehensive list. These are just some of the states that I wanted to highlight that have enacted either paid family, or very often these are just paid parental leave policies for state government employees. So a lot of them will provide paid leave for the birth or adoption of a child. The number of weeks varies from state to state. And what's really important about this is that it is a separate bucket of leave, because without these policies, the current situation for a lot of state employees is that when they're expecting a new child, whether through birth or adoption, they have to really just save up all of their vacation and sick days, and then they use up all of those when the child arrives. If they need more time, they would have to take unpaid leave. And then, they return to work, they have a new child at home, and they have no sick days left. And of course, for folks on the call who are parents, you got a new baby or a new child at home, you're going to need those sick days at some point. And so this is that helps explain why these policies are so needed in the public sector, so that folks can have this separate bucket of paid family or parental leave, and they don't have to use any of their sick days or vacation days. I also wanted to mention that dozens of cities have also enacted paid family leave policies for their own employees as well. And this has been a growing trend across the country. And, it's too many to list here, but that has been really exciting as well. And also a few years back, the federal government enacted a paid parental leave policy for federal government employees. So we've really been seeing a lot of progress in the public sector.
Hi, Feroza, there is a question in the chat. It says if there are small businesses or nonprofits in states without the public benefits and they wanted to independently offer paid family and medical leave benefits, are there private programs that allow them to save for that over time?
Yeah, I'm happy to jump in here. Generally speaking, that's likely an option for lots of employers who want to go ahead and take on this insurance and provide that to their workers. Insurers will sell you anything, so it's likely a product in most states. However, what we have seen is that those tend to be pretty expensive. So that's why it's a little easier for the big guys like a Google or a Microsoft to be able to provide that like on a very like just us basis. But for the little guys like small businesses and nonprofits, these state social insurance programs help them out a lot because it makes them only, it allows them to only pay a few dollars into the program per week, give or take, per employee, while allowing their employees to have these pretty critical benefits.
Yes, thanks, Cassandra, and thanks. That's a great question. I think the other challenge is we've seen that, the voluntary option, it doesn't tend to increase access in a meaningful way, especially for workers who really need these protections, especially for lower wage workers. But certainly it is, an option. So I did want to take a moment to share, specifically zooming in on the South. I saw that we did have several folks on the call who are based in the South. So it's great to have y'all. We've been having a lot of progress, particularly in the public sector in the past few years. So North Carolina, Georgia, South Carolina, and this has just been signed into law here in Tennessee. But all of those states now provide dedicated paid parental leave to state government employees. Texas has a bill that is currently moving through the legislative process. We're hopeful that that will get over the finish line. What's really exciting is that we've also been seeing significant progress in the South for public K through 12 school teachers. So Georgia was the first Southern state to provide dedicated paid parental leave to their public educators. And once again, this has just happened here in Tennessee, that our legislature has passed a policy, which is 6 weeks paid parental leave for birth, adoption, or stillbirth for public school teachers and administrators. The other exciting thing that happened here in Tennessee is that lawmakers included a recurring little over $15 million appropriation in the state budget that will reimburse local districts for the cost of the leave. And we're really excited about that development because it will help really ensure robust access for those public school teachers. I also wanted to mention that South Carolina has a bill that's moving. It has passed their state house. It is moving through their Senate as we speak. That would also provide paid parental leave to public teachers. So, again, hopeful that that will get over the finish line as well. I also mentioned earlier, we've seen a lot of progress for local government employees. Again, there's many more Southern states than what I've listed here, but these were some of the campaigns, that we supported on. And, Birmingham's just passed earlier this year, and it is 12 weeks of paid parental leave for city government employees. So certainly really exciting. And, we're also seeing not only more policies, but, higher number of weeks and more generous policies for public sector workers, which is really exciting. And I do just want to touch on, these public sector policies are so important. First of all, it covers tens of thousands of families in these states, and it also helps kind of set the example and put more pressure on the private sector. And so, we do feel that these public sector policies are really important and exciting. Moving away from the public sector, I also wanted to mention some innovative things going on in Louisiana. For those of y'all on the call who work in, more conservative states, that we as advocates do have to get really creative with our different tactics that we're using, trying to get to the same end goal, right? I mean, we want to get to that comprehensive social insurance program that Cassandra was describing, but sometimes the path is going to look different depending on the state. So in Louisiana, they were able, a couple of years back, advocates were able to pass a resolution that created an official task force to study the issue of paid family and medical leave and make recommendations. It was amended at the last minute to include a bit more representation from business community groups, but nevertheless, they were able to get a great report out of that with a lot of good information. And in the following legislative session, they were able to get an appropriation of state funds to contract with an independent consulting group to conduct what we would call an actuarial study. It's really just a cost study, looking at different options for how Louisiana could structure a comprehensive program to cover all workers in the state, and really crunching the numbers and showing like, this is how much of a payroll contribution it would require. And, looking at whether it's 8 weeks, 12 weeks, 16 weeks, kind of analyzing some of those different options. And so that report is being finalized, and that will be a really great tool, especially because, it comes from an independent third-party consulting firm. Several other states that have enacted comprehensive programs have done something similar. And so, we're really excited. And yes, I'm seeing a question in the chat. Will that report be public? I'm not totally sure yet of what the distribution is going to look like, but we'd be happy to follow up once it is finalized. And there's also a bill right now in Louisiana that we helped to draft that is, would create sort of this comprehensive statewide program. The contributions would be split between employers and employees. And so we're hopeful that the actuarial study will be a great tool to sort of help move that forward. So one thing I wanted to touch on as well, really briefly, and this doesn't just impact the South, as you can see from this map, but it is certainly more acute and concentrated here in this region. But that's the impact of state preemption. I'm sure many folks are familiar with this in your own states, but as you can see, many states prohibit local paid leave laws. So for example, if my city of Nashville wanted to say that private businesses that are operating in Nashville have to provide some minimum level of, paid family leave to their employees or paid sick days, they are currently prohibited by state law from doing that. And this is part of a broader and unfortunately growing trend of state interference in local decision-making that touches many, many issues. I know it impacts a lot of public health issues that American Heart Association is also interested in. But again, like I mentioned, we as advocates have to get creative. So there are different creative options to still increase access to paid family leave, even despite these state preemption laws. We mentioned the public sector policies. There's also some localities that have looked into setting minimum paid leave standards for contractors. So if you're contracting with the local government, to have some minimum standards, but it is something important to be aware of as sort of a factor when we're trying to think about how do we increase access in our communities. And the last point that I wanted to mention very briefly is the American Rescue Plan funds. I just want to make sure that folks are aware the federal government has confirmed that these funds can be used for paid leave. And, most states and cities received their second round of funds last year. There may be some who have not allocated or spent all of that money yet, particularly at the local level. And, the timeline here is pretty, long term. And, folks may not realize, but policymakers do have until the end of 2024 to allocate the funds, and they have until the end of 2026 to actually spend the funds. So I just wanted to make sure that that was on your radar. If you are thinking about, how do we approach this issue in our community? And of course, cost always comes up as a question that it might be worth looking into whether there are any remaining ARP funds in your community that might be used to help support a policy like this. And a better balance, we do have a lot more information and resources on this point on our website. Yes, thank you for the question in the chat clarification. Yes, we are referencing the state and local fiscal recovery funds from the American Rescue Plan. That's correct. And we do have a lot more information on our website, so that'll be included after the presentation when you receive the slides. So that was all we had for today. I think we'll go ahead and open it up for questions.
We had a couple of questions earlier in the chat. The first one was from Stephanie, asked, does the paid family medical leave contribute to the Pregnant Workers Fairness Act?
Yeah, that's a really great question. I can kick us off if you want to chime in too, Feroza, in a moment. But so these are two separate pieces, but they're related in that the Pregnant Workers Fairness Act, it's what we call an accommodations law. So it creates the ability for workers who are covered by it to be able to request a reasonable accommodation in relation to their pregnancies. So in some cases that might look like leave. The leave may not always be paid. So it gets a little, it's really dependent on sort of like what a worker might have through their employer. But that's a really important right. And we were really proud to, help with getting the federal PWFA passed. We have a lot of resources up on our website. So thank you for lifting that up. It's definitely an important piece of the overall framework for families and workers to be able to have good employment protections. But yeah, in the paid family and medical leave context, it's a little different because it gives workers an entitlement to paid family and medical leave for those purposes that I went over earlier, which includes, medical needs in relation to pregnancies, also includes bonding with a new child.
Another one came from Tori. She asked, can you share more information about the safe leave?
Yeah, absolutely. So I'll start by saying I breezed over it a little bit, but there is a really rich history of safe leave. So in this context, again, I'm talking about paid family and medical leave programs that might also cover the safe leave pieces. So that means whether a worker or their family member is a survivor of things like domestic violence or sexual harassment. In some cases, stalking is also covered. They might be able to use their leave to take time off for specific purposes in relation to recovering from that domestic violence or from that sexual harassment or sexual assault. So for example, if they need to relocate, if they need to attend a court proceeding, if they need to receive any sort of counseling. So specific purposes like that are often included, but it really varies from state to state. There are 4 states with paid family and medical leave programs on the books right now that that cover safe leave. So those are New Jersey, Connecticut, Colorado, and Oregon. All 4 of those allow workers to tap into these benefits for safe leave purposes. What I will say though, and I know that, these are separate things, but there are also a number of paid sick time laws throughout the country, whether at the state or local levels, that also give workers access to paid time when they need to use their safe leave provisions. And then, I'll also say that there are a number of unpaid safe leave laws on the books. So while they don't provide workers with pay when they need this leave, it does provide, job protection. So really variable and depends on the state, but we definitely have more information on our website.
Thank you. And we have another one from Mandy that was put in the chat earlier. It's kind of a 2-part question, so I'm going to put it in the chat. But the first question says, conservatives are getting more and more interested in paid leave, it seems. Can you address options that might fly in conservative-led states?
Sure. So again, and I will, agree with that assessment. We have seen more paid family leave laws and bills filed in more conservative states recently. Again, a lot of that focus has been in the public sector, which has been, really exciting progress, not only for those tens of thousands of families that work for state and local governments, but also in kind of setting that example and putting more pressure on private sector companies to provide those policies as well. I will also say that we are seeing some, as we mentioned earlier, more sort of voluntary options, more conversations around, oh, well, we can allow, private insurance companies, to provide these policies if an employer chose to purchase it, or, approaches like tax credits. And, so we have seen some of these bills, and folks may be seeing those in your states. I would say that our concern with a voluntary type of approach is whether it really is meaningfully increasing access, particularly for the workers who need these protections the most, particularly for the lower wage workers and workers of color. So, I would say we're excited in conservative states about the public sector progress. We're excited about things like the Louisiana Task Force and the actuarial study, which really gives a solid foundation and, this sort of independent third-party analysis of the costs and benefits of a program like this, which can hopefully then be used to sort of advocate for a more comprehensive program. And, I will say there's many conservative states. Cassandra mentioned there's a lot of states that have, active ongoing campaigns. There have been, comprehensive paid family and medical leave bills filed in many more conservative state legislatures. And so, certainly advocates are, pushing towards that in a lot of different states. And it is great to see more conversation and public conversation and attention for these policies. Cassandra, I don't know if you have anything to add.
That was fantastic, and I agree with all. And I'll just say, as Feroza said, we are actively thinking through ways with partners as we approach this conversation in red states. We're figuring out ways to be adaptive and to be innovative, to provide solutions to bring more paid leave to workers. So we are happy to have those conversations with you too. I see another question in the chat about non-biological folks. for the family definition. So how do we define that in the actual legislation? That's a great question. We've done a lot of thinking about this. All together as a team, and my colleague and I, Jared Make, we've done some work with our partners at Family Values at Work. We actually convene the Family Justice Network, which is a network of lots of orgs who represent a number of different policy issues and social justice areas to really just make sure that we are creating family definitions that do allow for all folks to be included and all families to be honored within these paid leave laws. So through that network, we've actually come up with what we call our model family definition. And it's one that can be easily plugged into really any paid leave policy. So for example, it's currently included in Connecticut's law. It's also included in Colorado's paid family and medical leave law. A number of states have used that or adapted it to make sure that all families are included within the scope of the law's protections. And I can also link to a public fact sheet that we have that breaks down the ways that we cover folks. But basically, our goal is just to make sure that in addition to including a number of what we call enumerated family members, so folks that you would expect to see like a spouse or a parent or a child of any age, so not just minor children. We also want to make sure to include those non-biological folks, which a lot of queer folks know as like a chosen family. So that can really look like just making sure that anyone with whom the worker might have a close personal bond or an equivalent relationship, or relationships that's equivalent to the family relationships that are listed in the definition are covered. But I'll link in the chat the document with the exact language. And I'll also, just while we're on family definitions, and unless there are any other questions, I'll also note that in partnership with the Family Justice Network, that I mentioned, and our friends at Family Values at Work, we've also formed a website called thisismyfamilyusa.org, which I'll drop in the chat too. And that really breaks down lots of worker stories that we've been fortunate enough to connect with and have been able to lift up on that website. It's in a video format, so they're really easy to really get familiar with. We also have a number of resources on that website breaking down the importance of these inclusive family definitions. So definitely would welcome folks and encourage you all to take a look at that. Okay, thanks so much, Jared. Well, if there are no other questions, I can go ahead and pass it back to Andrea, but we're definitely around and happy to continue these conversations. So please feel free to reach out.
All right. Before we close out, we have a few closing announcements. Sorry, I'm trying to get my computer working. Okay, sorry about that. Okay, so we're excited to launch our newest toolkit on the paid family and medical leave. Inside the toolkit, you'll find resources like our key message guides and customizable graphics, as well as sample language for action alerts, social media posts, and letters to the editor and op-eds. If you need it in the toolkit, the toolkit serves as a step-by-step guide for how to build campaigns, including recruitment, engagement, and mobilization. And this is all out of the toolkit, so it can be found on our website under campaign resources, which our website link is in the chat, and the link directly to the toolkit is also in the chat. We also have Voices for Healthy Kids supports advocacy campaigns and by mobilizing communities, advancing science and research through communications and messaging expertise, and the other forms of technical assistance, including capacity building for organizations. So if you have a question or need one-on-one campaign assistance, all of that can be found in the chat under our TA portal. Now, before I move on to our next announcement, I would like everyone to please open up this link. I'm going to give everybody 10 seconds. And just wanted to, emphasize what Sarah said before. We really do value and use your feedback to help shape our future trainings. So please open the link and take our brief survey, or you can take out your phone and scan the QR code. And we really appreciate everyone for being on the call today and hope to see you soon. Thank you.